Hello, my name is Jose Granados. I am doing my narration of a PowerPoint presentation on the overview of a patient care delivery system. The microsystem I want to talk about today is a cardiovascular ICU at Banner University Medical Center. It is an inpatient adult um, um, patient-centered um, healthcare microsystem that specializes in cardiac and lung post-surgical patients. Um, while there, the patients go through three distinct phases of care. Um, One is the admission phase. Basically, this is when the patient comes up from the OR and we attempt to stabilize them. The second phase is recovery phase. Um, this is the longest aspect of their or longest period of time of their care. We are, basically weaning the patients off medications, off the mechanical vent, addressing nutrition status, physical mobility, um, and to try to transition the patients over into the transfer process. The transfer process is the last phase of care. This is basically when the patient is stable, and they are requiring less than ICU status monitoring, so they transfer to the adult step down cardiac unit to continue with their care there. The next slide is leadership. Currently on our unit, we have a collaboration of shared leadership consisting of our clinical nurse specialists, four clinical leaders, two from days, two from nights, and a core group of very experienced nurses that um, help influence care and our staff within our unit. Um, they actively they all actively participate in direct patient care, and um, they're all so knowledgeable. They provide their knowledge through experiences that they might have had. Uh, and excuse me, um, the shared leadership group also presents evidence-based methods of practice through their attendance of conferences or workshops or other nurse organizations. The next slide is organizational culture and support. Um, our um, our unit has always had a strong culture of teamwork that's developed over the years. Um, this helps in two very important um, aspects of care. Is we help each other alleviate workload when a nurse might be overwhelmed, and we also make sure that everybody has their daily lunch breaks um, um, every day. The second aspect of this slide is the support. Our organization makes sure that we have adequate and easily accessible equipment at all times. Um, Adequate and easily accessible supplies at all times, and working um, order equipment that we can use to provide care. Also, our organization helps providing ancillary services such as unit-based pharmacists, physical therapists, nutritionists, just to name a few of the services that are resources that are um, easily accessible for the nurses. The next slide um, is patient focus and staff focus. Um, Patient focus, being a patient-centered um, care microsystem, we make sure that we address the patients at all times. And two methods of this is we are nurse to nurse shift report is done inside a room to um, allow for family and patient participation um, um, of their care. Also, the primary care team's daily rounds are also done inside the room to address any concerns or answer any questions that patients or family might have. The second aspect of this is staff focus. Our nurses are provided for continuing education through learning modules, huddles, annual competencies, and many in-services and demonstrations throughout the year. Also, initially they have a very high quality of orientation, which consists of approximately about 140 hours of direct patient care with night and with day and night shifts along, with an experienced primary preceptor. Let's see. Next slide is interdependence of care team. There are several members of the patient's care providers. But first and foremost, the patient is one of the members of this team. We actively seek for patient participation in their own care. The second team member of this is the nurse. The nurse is actually the one who does most of the patient's direct care, or gives most of the patient's direct care. The third member is the surgeon. They actually provide or give direction to the of how the patient's care is going to be managed, besides actually doing the surgery, of course. The fourth member is the ICU team. This consists of an intensivist and anesthesia residents, and they, along with the nurse, manage the day-to-day care of a patient. Last but not least is the ancillary staff. Too many to name here, but they all are influence the patient's care. The next slide is use of information in healthcare technology. We on the CVICU, we actually have an EHR called Epic, which actually is pretty streamlined. It allows for easy accessibility and quick access to patients' information. Another point on this slide is a technological one. Is we have a what we call an EICU technology or telemedicine. Excuse me. Being put in place on our unit, and this is it's pretty fancy technology that provides nurses with an additional resource to help in providing patient care. This is there's an intensivist 24/7 that is able to see and hear everything that the nurse does inside a patient's room through video monitors and cameras and such. The next slide is process for healthcare delivery. This is it's on our unit. We have we're pretty big catheter associated UTI infection prevention program. I tried to say that really quick, huh? This consists of the CAUTI bundle. Um, the CAUTI bundle is basically interventions that help decrease infection rates, such as making sure that you are doing correct antiseptic technique when applying the catheters, or using stabilizing devices to make sure the tubing doesn't irritate the urethra. Those are just a couple of the interventions in the CAUTI bundle. Also, the charge nurse does daily um, safety checks, and along with those safety checks, the um, 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 also the charge nurse does shift checks, and along with those is assessing for the CAUTI bundle as part of their daily or initial daily routine. Lastly is nurses document CAUTI bundle as part of their assessments. The next slide is staff performance patterns. This is has to do with individual and unit-based goals that are tied into our evaluations, and three that on the slide are staff retention goals, patient satisfaction surveys, and sustainability of a QI process. What we do is that all these goals are evaluated during our yearly evaluation, and are they're evaluated and interventions implemented based on these evaluations. The next slide is this is a specific aspect targeted for improvement. I chose staff focus as my area for improvement, and two concepts are adequate staffing and nurse manager support. Adequate staffing would alleviate many things on the unit, but basically it would eliminate the need for high acuity assignments. It would keep our charge nurse out of ratio to allow them to be available for other staff if they need help, and it would decrease a lot of the stress that comes along with these high acuity assignments. Nurse manager support would actually, I think, increase staff retention, and it would open up communication between management and staff to allow for development of positive relationships. The last slide is how I would go about in trying to implement one of these ideas, and my idea to submit to staff or present to staff was to create a liaison officer to act as a go-between staff and manager, and help address concerns and present ideas, and work with the managers to help with the staff perception of their support. This concludes my sorry. So to summarize, as a cohesive, dynamic unit of patient-centered care, our CVACU has been able to maintain a pretty high quality of care because of this excellent team of providers that we have. However, health systems are dynamic, and we need to change right along with that to be able to provide good quality patient care in the future. This concludes my PowerPoint narration. I will submit this. Thank you very much.